Hello and welcome to this A-levellectures.com lecture on the respiratory system, and specifically we'll be covering the content of the AQA syllabus, Unit 1, Biology and Disease. So first of all, a few different names given to the respiratory system and a few of the technical terms. So you might hear it referred to as ventilation or the pulmonary system. In actual fact, we're talking much about the same thing, really. We're talking about a system which provides the body with oxygen and gets rid of the buildup of carbon dioxide, which is a waste product. Okay, let's dive in a bit deeper into the respiratory system. So first of all, let's start off with some simple anatomy. So we know that we have the upper respiratory tract, which essentially consists of the nose and the mouth, and as you breathe that air in, it passes down into your trachea, and the trachea comes down and splits into two further tubes called the bronchi. We've got the left bronchus and the right bronchus, and those tubes get smaller and smaller. We end up with the bronchioli, and at the end of the bronchioli are the alveoli, which look a bit like a small bunch of grapes, essentially. A few other things then, so that's the lungs as an organ, but a few other structures we've got going on. If you can see at the bottom there, the dome-shaped diaphragm, that's in its rested state, so when it's not contracted. So we describe that diaphragm as being dome-shaped, and it changes its shape when it gets contracted, and we'll learn about that in a little bit. You can't see them here, but obviously the lungs are surrounded by a rib cage, and that rib cage is hard bone, and when your lungs move in and out as you inflate those lungs and deflate them, obviously there's a potential there for the hardness of the bone to rub against the lung tissue, and that could be quite painful. So we've adapted to have this thing called a pleura, and the pleura is a lining that surrounds the lungs, and inside that pleura cavity is pleural fluid, and that just acts as a bit of a shock absorber, really, to take out any friction that we may experience between the lungs inflating and deflating and rubbing against the rib cage.